Big news tonight about Obamacare. Guess what? It is here.
Not so fast. States are running into all kinds of Obamacare obstacles.
I'm actually a little bit nervous about what it's going to mean.
So we've seen some states where the options are not going to be very great.
Is it possible that this health care law is not yet ready?
This grand experiment 3.5 years ago is quite simply not working.
Obamacare is not ready for prime time.
It is day one of the first government shutdown in 17 years.
I was recently at Washington, D.C., where I got to see and hear the perspective of health funders from all across the country. And what that made me realize is that in Washington State, we actually are amazingly well positioned to really have the kinds of impact around the triple aim that fundamentally we would all like to see.
I've been to a few state reforms over the last few years, and I think it's a wonderful event. We're not talking about the same old stuff anymore at this stage in the game, and a lot of folks are willing to share more than they would in other settings at the State of Reform Conference, and so that's what I appreciate most about it.
I think now is an opportune time for us to create the future. We need to recognize that and collaboratively work together to create a new healthcare system that's going to benefit our population and our society.
What I am most impressed about is the passion and the commitment that everybody seems to come to the conclusion Washington needs to move in this direction.
And this is a huge moment because it shifts power. That's why it's been so toxic. It shifts choice. It empowers people and it brings people into a world from which they've been excluded.
Let's not forget how well positioned we are versus other states in the nation, and let's be a role model.